I'm an emergency physician in Yellowknife. I stand here as president of the Canadian Association of Physicians for the Environment to call on all federal political parties to treat climate change as a public health emergency and to demonstrate a clear plan and leadership coming up into the next federal election. I have stitched up scalps for Indigenous hunters who have fallen through the ice in temperatures already 3 degrees Celsius more than they were in the 1950s. I've given puffer after puffer to Canadians coughing from smoke from wildfires. I've comforted teenagers in the middle of the night who are worried about what climate change means for their future. And in the Horn of Africa, I have resuscitated children dying of malnutrition. Malnutrition will be the #1 health consequence globally of climate change. Sometimes I wasn't fast enough, and the babies, heartbreakingly, died. Sometimes I was fast enough and they lived. When lives are at stake, it is imperative that we act quickly. When we want to act quickly in the hospital, we call a code blue. When that happens, we move quickly to the bedside, we form a team, we assign a leader, and then we push hard and we push fast until we have the healthiest outcome possible. We need to call a climate code blue. We need to make sure that we keep global temperature warming below 1.5 degrees Celsius. Right now, we are headed for 3 to 4 degrees Celsius by the turn of the century. That means malnutrition, drought, migration, conflict, disruption of core public health and health infrastructure. I have a 5-year-old daughter. She will be 87 in the year 2100. She has already experienced severe wildfires in 4 of her 5 years. It is time for political parties to come together and work together. In the UK, cross-party collaboration facilitated a decrease in emissions of 41% between 1990 and 2016. In Canada, our emissions over the same period went up by 17%. Our team needs to fund clean air shelters for wildfires, and we need to flood-proof our hospitals, and we need to decrease emissions, starting with measures that will also decrease the air pollution that's leading to 7,100 deaths from fine particulate matter every year in Canada. We put a tax on tobacco that has led to healthier choices. Putting a price on pollution will similarly drive us to make healthier choices, leading towards clean energy, electric transport, pedal-powered transport, things that improve health for Canadians right now. Now, as an Emerge Doc, I have been with a lot of Canadians on the worst day of their lives, and I have been inspired by that. Canadians are courageous. They are graceful under pressure, and they are full of grit. That is why I know we can run a good climate code blue together. So I call on the parties of our political system, all of them, to represent the best in Canadians, to demonstrate the leadership, to show us the plan, to work together. Because when a code is being run well, everybody feels better.